Christmas and Happy New Year to you in advance. And I hope you will enjoy the quality of life and best of health in New Year. Today is the topic of varicose vein and its Ayurvedic management. Now, what is varicose veins? I think you must have seen a varicose vein commonly most commonly it is found in legs, and particularly women are more prone than men. So it is a twisted, swollen, bulging, and what you can say that inflamed. You can see that type of the shape of vein. It's a dark blue or purple color. There are two types of varicose vein. It is most commonly found in legs. Either it is usually it can occur any parts of the body, but most commonly it is found in the legs. There are two types of varicose vein: superficial and deep. Deep, where deep you can't see, it is invisible. Deep varicose vein, it is below the muscles, while superficial you can see beneath the skin, beneath the surface of the skin. That is quite visible, and it looks ugly when you see the legs or any part below this back, or below this. You can see here, you can see here, but it is very common in the legs. Now, superficial, this is not harmful. Superficial varicose vein, this is not harmful, while deep varicose vein is a fatal. It's not visible. Sometimes it creates problem of pulmonary embolism, and that's a most dangerous disease. Pulmonary, there is a clot inside this vein, and it can travel through the bloodstream. Other is thrombophlebitis, inflammation in the network of capillaries and veins. That is thrombophlebitis. This pulmonary embolism, this is very fatal disease. So, clot can occur here in pulmonary area, pulmonary, that is here, and it can damages the any organ or sudden cardiac arrest or whatever it can cause. Thrombophlebitis, inflammation of that entire system of capillaries and this vein. Now, two types of superficial varicose and deep vein. What are the causative factor of this varicose vein? Who is causes? What are the causes? Varicose vein. What are the causes of? This is commonly seen in I think this is seen in particularly in female, most commonly female rather than,
and more on the legs.
yes, male.
Even for laborers also.
Yeah. So, yeah, come in. Female is more prone to develop this disease than male, and it's a hereditary in the, if you have family history, anybody in your family is having this varicose vein, then you can develop this. It's a family history, and some causes are congenital defective valve. This is also responsible. Another cause is obesity. Obesity is there. If you are obese, then menopause, obesity, menopause, then obesity, menopause, Other this some pregnancy. Pregnancies, thrombophlebitis. Various causes: obesity, menopause, pregnancy, thrombophlebitis, and if prolonged standing, those who are working for long hours like teachers and other workers, so they can develop this varicose vein. Prolonged standing, hard worker, or they are putting more strain, more pressure on their legs. So that is the main cause of this varicose vein. What are the symptoms now? Symptoms: aching in the legs, fullness, heaviness in the legs, number one. And other symptoms, here you can see some swelling in the ankle area, brownish, brownish color of the skin, particularly in the ankle area, where you can develop varicose ulcer. Here in this patient, brownish skin, redness, itching, these are the symptoms of varicose vein. But particularly people feel pain in the night time, and after exercise, after doing heavy exercise, they feel pain here. Cramps is also there. Cramps. This is very common in varicose vein people. Cramps, particularly at the night time. Cramps. Other is when you sitting on the cross leg, at that time you feel pain. That is the cause, not a sign and symptoms. That is the cause, because cross leg sitting for longer period and sedentary life. This is also a responsible factor here. Cross leg sitting, it puts pressure on your legs as well as an ankles and knee both. Cross leg sitting for longer period and sedentary life. Symptoms: cramps and itching and redness and heaviness and fullness in the legs, particularly in the night time. It is more common. Skin ulcer you can develop. If varicose vein is not treated properly, then skin ulcer in the ankle area. This is very common, skin ulcer. If you are not treating it properly, then skin ulcer can develop, and it ruptures all the capillaries, and you see that is not, that wound is not particularly treatable, because in modern medicines there are so many types of treatment is there, but in Ayurveda the management is totally different, and cost factor is very high, and this is not treatable by the modern medicines and all this, because if you do any surgical procedure, endovascular surgeons, particularly this type of patient treating endovascular surgeon, so cost is more, 80,000 to 1 lakh rupees, and risk factor is higher, particularly in varicose vein. But if you develop skin ulcer, this is treatable. Within 30 days, you can get relief with the Ayurvedic management. Now, what type of remedies are available for varicose ulcer? Varicose vein, that is next step, but ulcer, suppose if you develop this ulcer, then how to treat? So there are so many medicines are available, but particularly this Jatyadi oil or ghee or ointment, this is good for ulcer, which is,
Even for cramps also?
yes, cramps you can apply this oil, and for foot crack you can apply this, because in winter season usually it's a very common, particularly in the sole region. So when you see any type of cracks in the sole, you can apply this Jatyadi ointment. Just clean this surface of the skin and dry it, and then apply this ointment. This is available. Ointment, yeah. It's available at Ayurvedic shop. This is oil, ghee and ointment. All the preparations are available in the market. Jatyadi oil, ghee, and particularly this skin ulcer we are treating with this ointment you can do. And this tablet is there, that is Sarivadi Ganvati. It's the 2 tablets 2 times with water. This is treatable condition, this varicose ulcer, that another you can apply this Yasti Madhu. Grith, this is also very good healer. Yasti Madhu Grith, yani ki ghee, it's medicated ghee. This is external application on ulcer. And leech therapy. Leech, you have to just apply the leech on this particular that ulcer. They will suck the impure blood from that area. That is also good option. Skin ulcer, Yasti Madhu Growth or Jatyadi Growth. Yasti Madhu, yeah, Jeti Madhu, yeah, that is Yasti Madhu. And even this is also useful, this Sarivadi Ganvati. This is Yasti Madhu Growth, external application. Ghee, medicated ghee. It is a medicated ghee. Yasti Madhu is a medicated. Yes. For cleansing the wound. This is for cleansing the wound. Within 30 days, you will see the normal skin, particularly in that portion, ankle area, because usually it develops there in ankle area, right? So this is treatable by these Ayurvedic remedies, varicose ulcer. And in modern medicine, usually what the doctor suggests, compression, stockings, right? But it is not that much, useful. Sometimes see that blood circulation stops in particular area, and sometimes it develops clot in the vein. So stockings and all other therapy is not that much beneficial to the patient. So what other option, alternative option in Ayurveda? There is a wonderful herb called Brahmi. Brahmi, yes. This is indigenous herb, Brahmi. Indigenous Brahmi. Now, what is the form, in which form you have to take? It's in extract form. Brahmi extract, you have to take 2 to 3 teaspoonful Brahmi extract. This is Brahmi extract. 2 to 3 teaspoonful with Yashad Basma, 1 pinch, only 1 pinch, this much amount of Yashad Basma with 2 to 3 teaspoonful of Brahmi extract 2 times in a day. You can take 2 times in a day after lunch and dinner, 2 times in a day. This is the, best remedy, particularly in varicose vein. Brahmi extract 2 to 3 with Yashad Basma, that you have to add. Yashad Basma is available, any standard pharmaceutical company.
How much period?
At least 1 month period you have to take, 1 month period, yes. And then you check, 1 month period you have to take this.
This medicine is available?
Yes, available all Ayurvedic shops. Yes, you can get from any Ayurvedic shop. This is herbal remedies. Another is
Varicose veins,
Varico-
not the ulcer.
varicose vein. Ulcer is different. That I have mentioned. Na, that now garlic. This is the, if you use it daily in your diet, this will ease the clot. This is the blood clot. This is also wonderful. Garlic. Then ginger. This is also good. Garlic, ginger is also good. Right? If you have cramps and other problems, you can take this regularly. And uncooked onion. Uncooked medium sized, not a big one. Uncooked medium sized onion daily. Is the permanent solution. This is permanent solution. Uncooked, medium sized. See, if you are taking this 1, 2, 3 regularly in your diet, if you are adding this,
Even other problems.
all other problem, extra problem will be solved, I tell you. This garlic, ginger, if you have developed some joint pains or see inflammation in the joints, particularly in knee, a lot of people complaining.
How much quantity?
See, 1 ginger and 1 garlic, 1 or 2, yes, and 1 onion daily.
At what time?
At your, lunch time, you can add in a lunch. All this. This is, see, herbal remedies, indigenous, it's freely available. You can, add in varicose vein and other type of, blockages. See, what is the blockages? Yes. Even I tell you, in hemorrhoids patients, those who are suffering from piles, what is that? Piles is nothing but it's a varicosity of vein. So you can take this medium sized onion, that is good, for piles patient. So those patients who are having a cardiac problem or blockages in the arteries, they can take all these things. And it will remove the blood clot as well as all the problems inside the arteries and veins. It removes the blockages.
Garlic also raw garlic.
Yes, raw garlic.
Yeah.
Correct?
Actually, it's for everything. Everything.
Yeah. Mixture of carrot and spinach. Juice. Daily. This will also solve the problem. Mixture of carrot and spinach juice you take in your diet regularly. This will improve the function of all this circulation. External application of fish oil. external application of fish oil. Fish oil, not over that vein, but surrounding area you can apply it, right? External application of fish oil. This is all herbal remedies or domestic remedies. Now, what is Ayurvedic management is different. Now, what is Ayurvedic management for this varicose vein? This is available capsule curcumin or capsule haridra, right? 2 capsule twice a day after lunch and dinner with water, plain water, with plain water. Number 1 is curcumin or haridra. This is Latin name of haridra. Now, what is haridra? Is turmeric. Simple capsule of haldi is available in the market. Capsule haridra is available. That is, you can take 2. Number 2, Kaishor Gugulu. Kaishor. This is number 2, Kaishor Gugulu. That is 2 tablets 3 times a day. First dose is after breakfast, second is after lunch, third is after dinner. You just break the pills and swallow it with lukewarm water. This is lukewarm water. Kaishor Gugulu, Haridra, all the
This capsule haridra used for tonic also, no?
Yeah. Yeah.
This haldi.
Haldi.
Even if you don't have problem,
You can take this. Even this, all the problems, joints, this is good. Even in cancer patient, you can take this Haridra. Kaishor Gugulu. Third is the Gotu Kola.
Even Alzheimer's can prepare.
Yes, yeah. Tablet Gotu Kola. Western name, Western herb is Gotu Kola. Indian is Manduk Parni or Brahmi. Same. Brahmi or Manduk Parni. This is Indian herb, right? Brahmi, earlier I mentioned Brahmi extract. Gotu Kola. Gotu. G-O-T-U. Gotu Kola. This is Western herb. Yes. Gotu Kola. Gotu Kola.
Go to Kola. Brahmi or Mandal. Botanical name.
Yes. Gotu Kola is Western herb. This is Indian herb. Same. Yes. Manduk Parni. Same. Brahmi or. Yeah. And last is Arjun tea. This is cardioprotective actually, but it works on the circulation in the peripheral, this vein and arteries. And Arjun tea is 4 gram crude powder of Arjun. Arjun is plain herb plus 1 cup of water. You can add and make tea, Arjun tea. You just boil it and then filter it and then drink it. This is Arjun tea. That is also useful, beneficial in.
But in market you get as a Arjun tea or Arjun powder?
Arjun powder you will get. Arjun powder. Arjun capsule is there. But this is best. Crude powder and you just boil it.
Boil it,
Yeah, that is good. Now, what about the external application? Here we will apply this oil, Chandan Bala Lakshadi Tail. This is Ayurvedic oil. Chandan Bala Lakshadi Tailam. Don't apply directly on the vein, but in surrounding area you just apply it. It will improve the blood circulation. This
But
Chandan.
while applying it will be,
Yeah.
it will go to the vein area.
Yeah, but don't touch that area. Otherwise, there will be problem. It will aggravate more and more. So you just apply side by side. Chandan Bala Laksadi, and another is Prasarini Tailam. Prasarini Tailam. These both oil are useful, particularly in varicose vein, and even in general massage you can apply it regularly on your body. This improves the blood circulation in the body. Chandan Bala, Lakshadi Tailam and Prasarini Tailam. That add this garlic, ginger, then turmeric, onion, then pineapple, then pear, apple, orange. I mean, you can take this regularly in your diet. All this garlic, ginger, turmeric, onions, pineapple, pear, apple, orange. Fish, consumption of fish is good. And whole wheat.
Omega-3 is useful.
Yeah, soya. You can add in your diet all this variety of foodstuffs. This is diet. Try to avoid red wine. It is not good. Red wine you avoid. And walking is the best exercise. Swimming is the best exercise. Riding the bicycle is the best exercise. Start the day with brisk walking, end the day with swimming or riding the bicycle. That is the best option for varicose vein patients. And asan, yogic exercise. This Paschimottanasana. Paschimottanasana. Then Sarvangasana. Paschimottanasana, Sarvangasana, Halasana. These three asanas are beneficial, useful, particularly for this type. Yes, increase the, it will reduce the pressure on that wall. So these are the best options. Yogasanas, Halasana, Sarvangasana and Paschimottanasana. Okay, so this is the management of varicose vein.